from the American Academy of Pediatrics.
I knew I was going to spend a lot of time changing diapers when my little guy was born, but I definitely did not know how much time would go toward thinking about poop, especially about whether he was pooping enough. Today, we're talking all things constipation in infants.
Part of the colon's job is to take the water away from the leftover waste and make those poops semi-solid. And we want soft poops because if you think about throwing a baseball, it's much easier to throw that spherical baseball. But if it were completely water, you're not going to be able to throw that very well. And so physics define that we would want to have a semi-solid structure to be able to poop out.
Welcome to Healthy Children, the podcast for parents from the American Academy of Pediatrics. I'm Dr. Edith Bracho-Sanchez. I am a pediatrician and a mama figuring it out. This is a judgment-free space where all questions are good questions, and the answers will hopefully be even better. Let's get started. Today, I am joined by Dr. Pat Reeves, who is a pediatric gastroenterologist and hepatologist in Texas. Pat, welcome.
Thank you so much for having me.
I am so excited to chat with you. Let's start at the beginning. What is normal, Pat, when it comes to pooping specifically for infants? And it may be helpful to break it down maybe in the newborn period versus what's normal when they start to eat solids. I'll let you explain to us.
Yes, ma'am. Thank you so much. Well, this is one of my favorite topics. When you come to talk about infants, we really first have to break it down for those first few days and weeks after birth as the child is getting accustomed to the practice of either breastfeeding or taking formula by bottle. There's a few benchmarks that are very important to consider. And then certainly, as you mentioned, once the child gains head control, strong neck control, and is able to intake purees and more complex solids, that's really when that defecation pattern can change. So first and foremost, when babies are born, we look for that very first poop, which we call meconium. It's typically a black and tarry looking substance to come out in the first 24 hours and really up to the first 48 hours after birth. There are some things where this can be delayed, but it's always important to know when that happened ahead of time. If your child is coming to the pediatrician or the pediatric gastroenterologist to be evaluated for constipation. Truth be told, we do have some really phenomenal guidelines that set out what is the normal pooping frequency for children who are less than age 4 years, as well as the ones that are probably toilet trained and walking, so greater than 4 years of age. And that comes to us from the North American Society for Pediatric Gastroenterology, Hepatology, and Nutrition. And so the short version of that is for children less than 4 years of age, we would say that having 2 or fewer poops per week is typically considered not enough. There really is more that goes with constipation, though, especially for infants, that needs to be thought about before we fully diagnose a child with constipation. Because constipation in and of itself shouldn't just be thought about, hey, is my child going regularly? We unfortunately have plenty of children that'll have a bowel movement every day. But if it is rock hard and solid, almost like rat pellets, that is indication that the poop has stuck around in the colon for far too long. So hopefully the colon has done its job, because when we digest food, whether that food starts out as liquid or as solids, it should become liquids for the most part as it enters the colon. Part of the colon's job is to take the water away from the leftover waste and make those poops semi-solid. And we want soft poops because if you think about throwing a baseball, it's much easier to throw that spherical baseball. But if it were completely water, you're not going to be able to throw that very well. And so physics define that we would want to have a semi-solid structure to be able to poop out. And so the colon performing its physiologic function to help dehydrate liquid poops, to give them some form, give them some structure, actually facilitates babies and children pooping.
Yeah. So there's so much in what you just shared, Pat, and I think it's really interesting that you mentioned that meconium, right? Because we really do pay attention to whether children pass stool, right? literally whether they pooped before they left the hospital is sort of the good way to remember it, right? And if
Yes,
they
ma'am.
pooped before they left the hospital, our level of concern about something very serious being wrong when a parent calls us, oh my gosh, I'm worried my child is constipated or my baby's constipated, our level of concern is a little bit lower if they passed poop in that first 24 to 48 hours before they left the hospital. Why is that, Pat?
That is because delayed passage of meconium really starts a chain reaction of concerns for the pediatric and newborn team. Really, it is our reflex to do more targeted and advanced testing to determine why isn't this poop that we know you have being passed when we know it should be. There's lots of different reasons for that. Some of those can go back to what we in the GI world call motility dysfunction, and that can be the nerves and the muscles that go all the way through the gut that are supposed to help propel and push food from mouth all the way down the GI tract and come out as poop. Those nerves or those muscles may not function correctly. There's other things where you can have what we call meconium ileus, which is where that black tarry poop has lots of other substances in it. There may be some abnormality in nerves as well, but it's not passing. And we do see that with other conditions, most classically cystic fibrosis. And so for us, early constipation in the first few weeks of life is extremely concerning and does certainly warrant more advanced diagnostics.
But what if, for example, right, like you are a mom, you just had a baby, this is baby number 1, and you're trying to get the breastfeeding going, or you're getting them used to formula, which sometimes can also take a little while. You just gave us some really good guidelines in terms of for kids under the age of 4, pooping less than twice a week is sort of considered / a red flag for constipation, but you're also taking into account the consistency and how hard the stools are, which is really helpful. But again, say that you're a mom who just brought their baby home and they passed stool in the hospital, right? They had their first beautiful stool, which is meconium. So we're not worried about those things that you just mentioned. But I'm still like, they haven't pooped in 2-3 days. Are we worried in that case? What should we do?
Yes, ma'am. So it is certainly going to be different depending on the nutrition your child takes in. I think anyone who's met me, I will tell you, food, nutrition is the most important medicine outside of mama's love that every child should have. And so it is known that children who are formula fed are typically going to have more poops, both in volume and more frequent than children who are breastfed. And now this is going to scare some people, I think.
Wait, really? They're pooping more? Babies who are formula fed?
Some of them certainly can. We do see a lot of other kiddos that are breastfed go 7 to 14 days between their episodes of pooping.
I'm surprised only because I could have sworn first that I learned that breast milk is a laxative. And my breastfeeding experience, I mean, I just couldn't keep up with how much my baby was pooping. So I guess I just had a different experience when I was breastfeeding. So that's very interesting to know. Now, tell us also, again, in that early period, sometimes it's hard to know. Like I sort of say to family, sometimes pooping is their exercise, right? Like there's not very much else that they're doing. And so babies can look like they're straining. They can look like they're getting a little red in the face. How do we know if they're actually straining? Do you have a magic way of knowing if our child is uncomfortable?
Sure. So yes, doing the leg dances and the toot dances and so forth is going to be completely normal. I would say that for the most part, I look for 2 main things when babies come to me for potential constipation. First and foremost, are they growing and developing adequately? And then second is there something else? Is there anything else going on for this child that's not related to pooping, which isn't normal? We look for kids who have really, really big bellies that we call bloating because of that excess gas that can sometimes build up. That can be because there's gas that can't escape through the colon by way of flatulence because there's so much poop in the way. So we look for bloating. But more than that even, we look for there to be vomiting. We look for there to maybe be other signs where the musculoskeletal system, the spinal cord, other things like that may have not developed accordingly and on the same spectrum of normal that we're hoping for. So really, I break it down again to growth and development. Hopefully it's
Yep.
normal. And is there something else? Of course, these visits are very important to get down into the dirty of the poop and determine, hey, what else is there going on? Especially in kiddos that are formula fed in pediatric gastroenterology. We see a high proportion of a certain condition, which we call cow's milk protein intolerance. It used to be called cow's milk protein allergy, and that can, in some instances, actually lead to constipation, though we typically see that children who have inflammation in the colon because of that bad reaction to the casein or whey protein found in dairy products, more often they tend to have a little bit of blood on their poops classically. We do see plenty of those kids who can develop constipation. And so trying to determine those things like, hey, parents, have you ever seen red stuff on the poops? Certainly, these babies are not eating strawberries or eating watermelon or other foods that have natural pigments of red in them that can change that color. They're just doing formula or breast milk, as it were.
Yeah.
And so it's really important to get into all this, because if your growth is not appropriate, if your development is off, or if you have something else, we really do need to put our thinking caps on to figure out, why is this child having an abnormal pooping pattern?
Yeah, I love that. Again, so much in what you just said, right? But if we're having a baby who is pushing and straining and seems uncomfortable trying to get the poop out, but for the most part, they are getting the poop out. They are growing. They are developing well. There's no signs that they have any sort of weakness. They're moving all their little legs and arms and they're super strong. It probably is just normal baby pooping, right? Which
Yes,
is
ma'am.
helpful, but again, super helpful also that you are telling us of all these other things to watch out for. Now, say that we are intent on preventing constipation, which first, our babies have to be eating some sort of solids, right? Because there's not that much you can do to prevent constipation when they're really just breastfeeding and formula, right? Like your options are a bit limited.
They are fairly limited, I would agree.
Right.
Yes, ma'am.
But say that they've started to eat. And now we want to prevent constipation, which I have to tell you, I have done, this is like pat on my back for myself, because I have at home made that a goal, because a child who's constipated can be so uncomfortable and it's such a bummer for the whole family. So this is definitely something that I have been intent on personally. So as a pediatric gastroenterologist, what's sort of your go-to things that you recommend to families who, like me, are looking to prevent constipation?
I absolutely agree. Yeah, and this is usually, especially if we're evaluating a child who is straining to poop in infancy, but otherwise, is doing great, growing, developing adequately. I first try and put the parents at ease to tell them that this is a normal variant of sorts. And, I usually crack the very awful and old GI joke of, I'm so sorry, guys, but your child's going number 2 is their number 1 problem.
I had not heard that one.
Oh, it's, iron sharpens iron. We've honed this one over decades. But specifically, I absolutely agree with you that there's not a lot of great options for the child who is pooping once every week, has soft poops, is growing, is developing, and has no other red flag signs. There's not a lot of great options. We don't really recommend empirically using anything to make poops that are already soft even softer. There's not really any need in the infancy period to initiate fiber supplementation for bulking, but there are 2 things that I talk about with parents that have been shown anecdotally to be helpful, and there's a couple of research studies to support them. One is sometimes these babies who come to us and have that infrequent but soft pooping pattern are going to meet the definition for infantile colic. And there is evidence to support that the probiotic Lactobacillus reuteri is helpful for breastfed infants who have colic to decrease those symptom scores of colic. And so in much the same way, it's always an option when I talk to these parents, normal child, no immune deficiencies, nothing like that. I say, hey guys, there is probably a high safety profile for this nutraceutical, this probiotic, and you could certainly try it. I would say that the greatest likelihood is that it doesn't work. And some parents try it, they love it. Secondly, I try to give parents, even when I think the pooping pattern is normal, but they're concerned, I try to give them sort of a backup plan. And in those instances, we really try and reach for a safe food as medicine option, something that's going to have a little bit of an osmolar burden and hopefully a good sorbitol content. And so that's going to be something like prune juice or pear juice that they might give in, say, 2-ounce servings to their child 1 or 2 times a day, especially if they're feeling like the child is backed up or straining and things like that. Really just that as needed, turn hard poops mushy again, food as medicine option.
I love that. Now, say that we have tried that. It didn't work. Our kid is getting really backed up. What are your next steps? And I'm asking you this because I think, unfortunately, at some point or other, most kids get constipated, right? Like, even for me, and like I said, I was intent on preventing constipation because I was like, not in our house. Kids are so uncomfortable. This just ruins everybody's day. It just throws off your routine, right? So I was like, not here. And my child still got constipated. So let's say we did this. We're trying a couple ounces of prune juice or pear juice when they do start to, eat solids, which for most kids is between 4 and 6 months. Work with your pediatrician, of course, to figure out whether your child is ready. But say we tried that and it's not working. What are your next steps, Pat? In addition to talking to your pediatrician, what would you say as a pediatric gastroenterologist?
So as a pediatric gastroenterologist, this is when it comes time to have a more thorough and thoughtful discussion. Again, we repeat everything we did already. We're doing discussions about developmental screenings. We're checking to sure not just is the child gaining weight, but what is their actual velocity of growth? Because the speed at which a child gains weight is very important. This is when you're coming to my gastroenterology clinic and we are going to have a naked baby and do a full exam head to toe. We're going to make sure we haven't missed any spinal cord anomalies. We're going to make sure we haven't missed any sort of abdominal distension. And this is when follow-up becomes so important because it's not just the first time I see your child and sort of get to know them. If we start therapies and I bring you back, it is correlating that we know those therapies are on board, but here's the exam of the child I have now that's so important. And then really, I think the big decision point in the general pediatrics clinic and gastroenterology clinic is that digital rectal exam. How helpful is that for the evaluation of children? And really on follow-up with the situation you describe, this is when doing a digital rectal exam in gastroenterology clinic can be very helpful because what we hope to find is lots of poop in the rectum because that would be indicating that food's able to start at the top at the mouth and make its way all the way to the bottom. But if we insert that gloved finger to the rectum and it's totally empty, especially if it's a very, very small space, then that's not normal because a constipated child should expand that rectum. It should basically be like a balloon that accommodates all the poop that's building up. But if it's not, that's when we have to reach for more sophisticated testing to evaluate the rectum and the bottom of the colon and see if there's something wrong.
Yeah. And so interesting that you mentioned sort of all the things that you do in your gastroenterology clinic, because I think, of course, as a primary care pediatrician, we partner so much with you all in gastroenterology, but also helpful for parents to know what may happen when they come see you, right? I think for some parents, hearing that, their baby's rectum might be checked is sort of like, what do you mean? Right? Like, what?
It can be traumatizing.
Of
Absolutely.
course. Yeah. But I think understanding what exactly it is that you're looking for is helpful, right? And you're looking to make sure that food is able to make it from the top, from the mouth, right? All the way to the rectum. So that's what you're looking for. And hopefully that is enough to get some poop out and give you that reassurance that food made it all the way from the top to the bottom. But again, good to know, right? To have a bit of a heads up. I do want to ask you one more question because you mentioned probiotics and specifically there being some evidence that they may be helpful in babies with colic, especially those breastfed babies. Is there any evidence that they might help constipation itself?
So there is evidence in older cohorts, predominantly adults, those with irritable bowel syndrome and constipation overlap, that some probiotics can help. I would tell you, as a person who loves the idea of use of pre and probiotics as therapies to hopefully avoid the long-term use of other medicines, I wish the evidence was more concrete. But I think the jury is still out on that. I think that especially in the setting of very, very mild constipation or not technically meeting the clinical criteria for constipation based on our Rome findings, that probiotics are an excellent potential adjunct that is safe, that we can try, that if the parents are willing to take on that cost burden, it should be safe for most children to attempt.
Okay, love it. We can try, right? It's one of those good old, we can try, even though the evidence isn't quite there yet, knowing that it's something safe. And if it works, great. And if it doesn't, then we stop them. But I have to ask you, I have seen parents get a little bit creative, really out of a desire to help their kiddos when they're constipated and make them more comfortable, right? I think that is all good and fine when we're doing bicycle exercises, when we're doing tummy massages, right? Like, all great. You're helping your kiddo. I love it. It does get a little bit scary though, as more and more things hit the market that perhaps are not the greatest idea. So I'm just curious because you must have seen so many of these things. Is there anything out there that you would say, be careful?
So there is a device that is on the market that is sold at regular grocery stores and so forth. And the idea is to insert it to the rectum of your child when you feel like they're backed up to evacuate gas. And it is over the counter. You don't need a prescription for it. And I would say that it's something that I have been told by parents is on blogs and, hey, use this, it helps. If you are using that sort of a device regularly, that is a problem. And it indicates a more concerning potential type of constipation that a gastroenterologist should evaluate because it is the potential for things, same condition as the tight, empty rectum for a constipated child. It could be that you are essentially medically evacuating your child and keeping them from fully showing you scary signs and symptoms, and you may be precipitating a problem. So just like is on this podcast, every episode I've ever listened to, please be in close conversation with your pediatric medicine care team to ensure that whatever you're using for your child is approved and safe. But if you think they're constipated, please bring them to us and we'll happily evaluate them.
I am so glad now that I asked you that question. And it gets at a larger point that parents can get quite creative out of desperation and a true desire to just help their babies. So we see you, we know what you're trying to do, which is help your baby. Mm-hmm. Just come tell us what it is you're using, because really there could be an issue that we're not addressing and diagnosing appropriately, as you said. Pat, as we come to the end of our show, we like to end with what we call a parenting prescription. So when it comes to constipation in infants, what is one thing you want all parents to know?
Absolutely. Well, first, I would say that constipation should never be a solo journey, because you parents would not believe the thousands, maybe millions even, of children who are struggling with this, and the parents co-struggling to try and help normalize this pooping pattern. It is so prevalent, in fact, that our National GI Society, which we call NASPGHAN, has a complete open access guideline that even you can get to and read that has a beautiful flow chart of babies start here and you should go here step by step, even with medication recommendations. So I think in the perception of advocating for your child, making sure that your pediatric medicine provider is aware of this guideline and use that sort of as your I Love Me book for your child and track them through the progression of this process, because it even gives you a heads up when to consider going from your general pediatrician to the peds gastroenterology clinic. And one other helpful thing is I actually am the primary author on our healthychildren.org article on constipation in children. We just rewrote this about a year ago. And in that, you can see several other helpful features about treating or preventing constipation and a hyperlink to get over to that guideline.
I love that. Dr. Pat Reeves, thank you so much for joining us today.
It was my absolute pleasure. Thank you so much for having me. I hope we get to have more chats about other GI things, nutrition, feeding, and all things to help children thrive.
I love that. Open invitation, definitely. And thank you at home for joining us as well. If you like the Healthy Children podcast, please subscribe on your favorite podcast app and help us spread the word. Follow Healthy Children on YouTube, Instagram, Facebook, and Threads at Healthy Children AAP, and be sure to visit healthychildren.org, the parenting website of the American Academy of Pediatrics. Healthy Children is a production of the American Academy of Pediatrics. Our creative team includes
Laura Alessio,
Catherine Beard,
Garrett Brown,
Zach Christman,
Ann Johnsos,
Kathy Jewell,
Claire Keating,
Doug Nagel,
Jackie Ortega, Susan Stevens Martin,
Mary Claire Walsh,
Hannah Weston.
And our theme music was composed by Doug Nagel. We'll be back next week. I'm Dr. Edith Bracho-Sanchez. Thanks for listening.